Hi, this is Ramya from TechEduMaster near MISC Medical College, Kolancheri. So today I'm here to discuss about the situations in which you can use past tense while writing an OET letter. There are mainly three situations where you can use past tense. The first one is that when you are writing about the patient's condition in the past. Okay, how was the patient when he was admitted to the hospital, or what all problems he was experiencing when he was taken to the hospital? So when you are writing about these situations, it's better to go for writing. It's better to write in past tense. I can give you some examples for that one. He appeared he appeared confused, but there was no signs of agitation. Okay, so that means he appeared to be confused. Okay, when you are writing symptoms like that, it's better you can go for writing that one. Another example is like on admission. Okay, on admission, Mr. X had severe pain radiating to his left arm. Okay, so he had severe pain. Another thing is like Mr. X was experiencing severe pain at the time of admission. So that is something we cannot write experienced. We have to write experiencing because he was experiencing that time. At that particular time, he was experiencing it. Okay, another example is like prior to admission, he was living in a rental accommodation. There also, we cannot write he lived in a rental accommodation. It was like he was living there. Before admission to the hospital, he was living in that particular area. So it's better to write like he was living in a rental accommodation. Okay, another second time or a second place where you have to use past tense in OET writing is like when you're writing about the events that is completed in the past. Okay, those events which have already been completed. Okay, that has been finished. So what are the situations? What are such situations in the case note when you are writing about the admission details? Okay, like for example, she was admitted to the hospital with the symptoms suggestive of pneumonia. So she was admitted to the hospital with the symptoms. So that is something which happened in the past. So it's better to go for writing she was admitted to the hospital with the symptoms suggestive of pneumonia. Or else, another example is like his respiratory function deteriorated, necessitating transfer to ICU for intubation. So in such situations also, when you are writing about similar situations, you can go for writing past tense. Another thing is like when you are writing about some investigations that was carried out during the hospital stay. Blood test revealed elevated inflammatory markers. When you are writing about these test or test, when you are writing about some test that happened during the hospital stay, it's always better to go for writing past tense. Okay, another last one is like when you are writing about the nursing management performed in the hospital stay. What all management you have done when the patient was in the hospital. There also it is better to write in past tense because management done during the hospital stay is finished. Okay, that particular whatever you have done, that is finished. So it's better to go for writing past tense. Example, he was treated with IV antibiotics along with oxygen supplementation. So he was treated with. Another one is like she was initially given oxygen and antibiotics. Or else when there is a visit by a hospital dietitian or a physiotherapist, it's better to go for writing in past tense like she was seen by the hospital dietitian or she was seen by the hospital physiotherapist who initiated whatever it is. The rest things will go on. Okay, so when these are the three situations in which you have to use past tense when you are writing an OET letter. So I hope this is clear. Thank you.